Hi, everyone. Thank you so much for joining us for today's HTRC Education Series session. My name is Haley Bell. I'm the Program Manager for the Heartland Telehealth Resource Center. I'm joined today by our colleagues at the TexLa Telehealth Resource Center, Caroline Bowers and Kelly Munoz. And we have the pleasure of hosting today's session for you. I do have just a few notes before we get started. The session is being recorded and we will share it with you afterwards. Please feel free to use the chat for any questions that you have throughout the webinar, and we'll get to those there at the end. And then if you would like a completion certificate, please contact us at htrc@kumc.edu, and we will get those sent out to you. If you could please just put your full name as you'd like it to appear on the certificate, that will help us get those processed a little bit quicker. And so yeah, we can go ahead and get started. I will introduce our first speaker, Megan Alalde. Megan is a study coordinator and a registered dietitian on the I Am Healthy Parents First and I Am Healthy Clinical Practice Guideline Studies through the University of Kansas Medical Center. Her research focuses on building healthy behaviors in children and adults in rural parts of Kansas through technology. So thank you so much to Megan for joining us today, and I will pass it off over to our friends at TexLa to introduce our second speaker.
Hi, everyone. My name is Caroline Bowers. I'm the Program Manager for the TexLa Telehealth Resource Center. I just want to introduce one of our speakers, Dr. Logan Winkleman. Dr. Logan Winkleman is an Associate Professor and Program Director for the Master of Science in Clinical Mental Health Counseling program in the Clinical Counseling and Mental Health Department within the School of Health Professions at Texas Tech University Health Sciences Center. She also serves as the Assistant Dean for Faculty Academic Success within the School of Health Professions. She is also a licensed professional counselor, supervisor in the state of Texas, and has worked in higher education for the past 13 plus years, specializing in mental health counseling and professional development consultation. She has dedicated time researching topics such as emotional intelligence and health education, mental health care during the COVID-19 pandemic, and women's reproductive health concerns. Her other research interests include access to mental health and wellness resources, telehealth, and integrating behavioral health intervention in health education. Her clinical service focus is working with adults exploring issues such as career and professional development, life transitions, self-esteem issues, coping skills, depression, anxiety, mindfulness, and self-care. So thank you so much to Dr. Winkleman for being here with us today, and I'll now pass it over to you to get us started.
Wonderful. Well, thank you so much. I am excited to be here. I'm going to start sharing my screen here. And hopefully my audio is coming through. I think it is. I'm seeing some head nods. So, I am really excited to present to you today. I love the topic, especially when there's an interprofessional lens to it, when we're looking at nutrition and mental health care. And I think it's often underutilized and undertrained. And I'm going to be talking a little bit about that in my slides today. So I appreciate that, Caroline, for the overview. So I won't repeat anything that was already discussed, but I do have three main responsibilities to my role. So as a faculty member, I have teaching responsibility. That is one of my number one roles. So here I'm committed to our Master of Science in Counseling program. So within our department, we have three counseling programs. The program that I oversee and lead is the Master of Science in Clinical Mental Health Counseling program. We also have an addiction counseling program and a clinical rehabilitation counseling program, which I'll talk a little bit later on. My next piece of my role is research. So research is a critical component of my responsibilities. So along with my faculty, we're engaged in many different scholarly activities that contribute hopefully to the advancement of the field of counseling and mental health counseling. So as Caroline said, some of my research interests include exploring innovative therapeutic approaches, understanding the impact of mental health interventions on diverse populations, and how mental health can be integrated into all areas of healthcare. Just like what we're going to be talking about today, how nutrition can be integrated, that's something that there's so much overlap that when we stay siloed in these specialty areas, there's a reason for it. We want to be specialized, but we also want to be knowledgeable so that we can provide better care to our patients. So the other piece to my responsibilities is service. So that is service to the university and the wider community. So I, along with all of the clinical mental health counseling faculty, practice. We provide counseling services through our own clinic, which is the Your Life Behavioral Health and Wellness Clinic here in Lubbock at Texas Tech University Health Sciences Center. And I'll share a little bit more about that too. In addition to that, I also serve on various committees within and outside of the university that looks at kind of governance and strategic planning. And then I also collaborate with local, state, and national, and sometimes international professional organizations to develop and implement mental health initiatives and with the aim of raising awareness to ultimately improve access to mental health services. So that's just a little bit of a summary of my role here at the Health Sciences Center. So I mentioned I would talk a little bit more about our program. So we were established in 2017. And we were one of the first counselor education programs and still remain one of the only programs in the US to train practitioners simultaneously in counseling skills as well as telehealth techniques. And this was, if you notice, this was even before COVID. So after COVID, many counseling programs realized, hey, we've got to be able to not only provide our curriculum online, but our counselors are going to need this training. So this is something that was foundational to our program. We're also accredited by the Council for Accreditation for Counseling and Related Education Programs, or for short, CACREP. And that is something that we're very proud of. So that means that we reach the highest standards of curriculum, making sure that our graduates are very well trained so that, again, we can increase the access to mental health care services in Texas and the United States. So a little bit about our clinic I mentioned. So we established our clinic a couple of years ago. I think we're going on year 2 now. So the Your Life Behavioral Health and Wellness Clinic, we offer a variety of services. So this includes children and adults. We do in-person, but we primarily designed our clinic to provide remote services through telehealth. So in each of our counseling rooms, we have state-of-the-art telehealth equipment. And some of our services include diagnostic assessment, including addictions and mental health. We have family and couples psychotherapy, individual psychotherapy, group psychotherapy, family and group psychotherapy, and then also continuing education training. So in addition to providing individualized services to clients, we also provide continuing education for providers, specifically in the area of mental health counseling. And something that's not on, oh, we do, I did include it on here, is group. So we're starting to integrate more groups in our clinic. So that is something that we're very proud of. Especially for a counseling program, not many counseling programs also have their faculty participate and provide clinical services, and that's something that we're very proud of. I wanted to include our contact information for the clinic. So we're located on the Texas Tech University Health Sciences Center campus, which is at 3601 4th Street, Lubbock, Texas, and we're located on the 3rd floor. In Pod A. So if you're familiar with the Health Sciences Center, we're in pods A through D. Pod A is the far east side of the building. If you do, I've included our contact information on there, but if you do have questions about that, I'd be happy to share a little bit more. But I wanted to talk more about the integration of nutrition and mental health, which has been kind of a neglected area. So I don't know if many of you are familiar with the passage of Texas Senate Bill 25. So this is kind of a transformative shift in how health professionals are educated in Texas now. So this bill is related to health and nutritional standards to ultimately promote healthy living. So this includes requirements for food labeling, primary and secondary education, higher education, continuing education for certain healthcare professionals, and so on. So I won't go into all of that. My arena is in higher education and continuing ed for professionals. But basically, this is a significant legislative step towards enhancing public health across the state. So it was passed this year. And it's supposed to take effect September 1, I believe, of this year. And so it aims to address a few different areas, like I mentioned, but primarily when it comes to health professionals education, what we're looking at is the bill mandates that health-related programs incorporate a more comprehensive curriculum that emphasizes preventative care, nutrition, and mental health, but mainly nutrition. So this ensures that our future healthcare professionals are better equipped to address the more holistic needs of our patients. I know that you've probably been to a provider before, and then you had to go to a specialist and then another specialist. And that's probably not going to change too much, but what this bill does is it encourages healthcare providers, one, to be more educated on preventative care, including nutritional education. It also emphasizes interdisciplinary training. So Senate Bill 25 encourages the integration of interdisciplinary training in health education. So this will hopefully foster more collaboration among different health disciplines. So think of nursing, medicine, mental health counseling, nutrition to provide more cohesive care. A few different areas that this bill is benefiting. So some are a little worried of how do we integrate this into our education? And I look at it more of an opportunity. So currently there are some training gaps in our education as counselors. So despite the growing recognition of the interplay between nutrition and mental health, there is a notable gap in the training for counselors, at least, on nutritional guidance. Many counseling programs do not include comprehensive education on the topic, including our program. And this is something that will change moving forward. But I was very excited to see this bill get passed because that allows us to integrate nutrition education into counseling curricula. So by incorporating that, that allows us to educate our future counselors to prepare them to address some of these nutritional aspects. Now, in no way are we going to replace our registered dietitians. We clearly need that specialty. It's really just that interplay so that there's more interprofessional collaboration. So hopefully we want to offer more workshops and continuing education on the topic focused on nutrition and mental health, and to help current professionals expand their knowledge and skills. Again, we want to promote that interdisciplinary training, so encourage that collaboration. So this webinar is doing that. So we have a mental health professional and a nutrition professional collaborating to provide you content on the topic. So that interdisciplinary approach allows not only our students to gain insights, but our current professionals, and you can hear it from multiple perspectives. And hopefully this will also allow us to develop partnerships with nutrition programs. That's the goal, at least my understanding from our provost is to establish partnerships with nutrition programs that can provide our health professional students with access to resources and expertise to enhance their understanding of how diet impacts overall health, and specifically for counselors, mental health and well-being. So we want to close the training gaps. We want counseling programs to be more equipped to prepare our future counselors with the tools that they need to support their clients more holistically, addressing both psychological and nutritional aspects of mental health, because there is clearly an overlap in the literature. So why this has taken so long to get here, but it's here and we're excited for it. So that comprehensive approach can hopefully lead to more improved client outcomes and a more integrated care model for our clients. So kind of wrapping up, I like emphasizing the importance of collaboration across various disciplines. This enhances the quality and reach of mental health services and benefits. So the benefits include more comprehensive care. So working with professionals from different fields such as medicine, nutrition, social services, nursing, other specialties. Again, that ensures a more holistic approach to mental health care. We also can come up with more innovative solutions. So when interdisciplinary teams are working together, we generate more creative solutions and interventions that may not be possible with one single discipline. And then shared knowledge and resources. So collaboration allows us to understand you're going to learn something today about resources that you weren't aware of prior to coming. And that sharing of expertise and resources really helps improve the service delivery and outcomes. So to wrap up, I always like to end with one of my favorite resources, specifically for mental health crises. So some of you may have heard of this hotline, the 988 hotline. It's a nice nationwide mental health crisis line for the United States, and it provides immediate support for individuals experiencing mental health emergencies. So it's similar to 911. That was why we wanted that 3-digit number. So anytime I have a client come into my office, I always have them put this 988 number into their cell phone before they leave in our initial session. And anytime I get a chance to share this number, because it's not just for individuals experiencing mental health crisis, it's for families or concerned friends or anyone seeking support. Maybe you don't know who to turn to. This is a number that can help you connect to resources. So trained counselors are available 24/7, 7 days a week, and they're in multiple languages. They now have American Sign Language. So it is an incredible resource. It also helps with resource connection. So say you're in a very remote area, the hotline can connect you or individuals that call in to local mental health services or resources for further assistance. So this is an incredible resource that we want all of our healthcare providers and community just to be aware of. So I want to include my contact information on here. So if you do have any questions about some of the things that I covered or anything that I can help with, please feel free to reach out. I would love to connect with you. And I'm going to turn it over to my colleague to have her share her expertise in why we're here today, to learn a little bit more about nutrition and its interplay in holistic health. So I'm going to go ahead and stop sharing. Here we go.
Yeah, thank you so much, Dr. Winkleman, for that information. We will now switch over to our other presenter, Megan. So you can go ahead and get your screen shared. And Megan will be talking about her role and kind of how that touches on nutrition. Thank you.
Awesome. Thank you so much, Haley. And thank you, Dr. Winkleman. That was fascinating to see all the work that you're doing in your area, in the state, and nationally. It's just so, so cool. So as Haley mentioned, my name is Maggie Olalde, and I am a registered dietitian, and I'm a study coordinator. So I took a little bit of a different path than most dietitians coming out of grad school. And I will be sharing about a few of our research projects, one that has already wrapped up, and then one that is currently ongoing. And I'll just focus on areas that we have really utilized technology. And I do think that there is a lot that transcends to other areas as well. So hopefully you can learn some things as well that we're doing. And I would love to learn if anyone else has any tips or tricks or anything too. So I will start. That first slide showed our ongoing study. This study right here is I Am Healthy. So this took place from 2017 to we wrapped it up in 2022, called I Am Healthy Schools. We partnered with rural schools across the state of Kansas. So I am up here in Kansas City with the University of Kansas Medical Center. So we were trying to figure out how do we provide this healthy lifestyles program to all of these rural areas. Some have great internet connectivity, some really don't at times. So how do we do this? How do we go from all the way up here to all of these different areas with our intervention? And I'll back up even just a little bit further. So prior to beginning I Am Healthy Schools, we were doing similar interventions with schools. So on this picture on the left, you can see we would come in and be on a TV. We would have this webcam and have all of the families who were participating in this study join at the school. So everyone would have to come to the school. We'd see everyone on the webcam. And this was around 2010 or so. And actually, what's funny is with technology, that was pretty innovative for the time. So this was very cool to see someone on a screen being able to interact with somebody. And then we moved for I Am Healthy Schools to Zoom and iPads. So for this project, everyone received, each family received a study issued iPad that also had internet connectivity. So once again, this was 2017. It's crazy 8 years ago. This was very cutting edge. And so especially this was before COVID. So there were a lot of families who weren't very comfortable with this, kids who didn't understand Zoom, the concept. So it was fascinating, especially the fact that we continued our program through COVID to see how much more comfortable people got, even just grasping how to say on screen, muting, unmuting, the basic things that we all are very familiar with. It became a lot more natural for these families. And what was really cool to see is that towards the beginning of the programs, especially those that started earlier, the families would be a little bit more hesitant to interact with people. But as people got more familiar with Zoom and being on screen, there were just so many more interactions, which really helped for people to learn from each other as well. So a little bit more about the program. This was for elementary age kids, specifically 2nd through 4th grade. Kids to be eligible needed a BMI percentile between 85th to 99th. And we had 2 different groups that each school was randomly assigned to. We had an iPad group that you just saw, and then we had a newsletter group. So you can see an example of one of our newsletters on the right side. Both groups were lasted for 8 months. So the iPad group, they had individual and group meetings over iPads from their home. And then those in the newsletter group received very similar information, just in a very different format, a newsletter, an abbreviated version. And those newsletters were given monthly over that 8-month process. So the purpose was to compare the effectiveness of 2 active pediatric obesity trials, either I Am Healthy or the control, that newsletter group. So to give you an idea about what kind of things we covered, this is a slide that shows the topics for each of our group sessions. You can see on that left side that those in the iPad group were part of 8 weekly sessions. And then following that 2-month period, they changed to monthly sessions for that following 6 months. So the very first session for that session 1, we talk about goal setting. That's really the foundation for the program, for all of both this program, I Am Healthy Schools, and then the one that I'll get to in a little bit, I'm Healthy Parents First. We end each group session with goal setting. Each parent and child would set goals around what they wanted to complete before the next group session. And then we start with how did those goals go at the following group session. So it's a great time for parents and kids to both talk about their successes, things that didn't go well. And then one of the great things about it being a group format is that you're able to interact here. Hey, this didn't go well for me either. Here's what I've tried. Or really just being able to solicit that great conversation and troubleshoot with those families in their own area. So you can see some other nutrition topics. We talk about the stoplight diet, which I'll talk about in just a second. That calorie counting, portion sizes, my plate, and tempting situations. Those tempting situations are things like family barbecues or holidays. And then we also go into energy balance, nutrient density. And then on top of that would be, we have quite a few sessions on physical activity and really emphasizing that and making those activities fun and enjoyable. And then we have some behavioral topics too, to help to make these more sustainable changes. So our goal is to really provide a well-rounded experience of what it looks like to be healthy. So I mentioned that stoplight diet that is discussed. And the first thing that we say when presenting the stoplight diet is it's not a diet that you would think about when you hear a diet in magazines where you're cutting out specific food groups or really limiting something. It's very restrictive. This is just really a way to reframe how we think about foods. And one of the great things about this is it's been around for several decades, and it has been shown that kids as young as 4 can implement these things. So this is all based on nutrition labels, and some families are very, very knowledgeable with nutrition labels. They're very comfortable when they get into the program, and others really haven't looked at them before. So this is something that we teach everyone, no matter where their knowledge level is coming into this. You'll see the very top bullet are red foods. These are foods over 7 grams of fat and or 12 grams of sugar. And these are foods that we definitely don't any shame around. There's nothing bad about having red foods, but we just really want to be mindful of them. We want to limit them if possible, really keep them out of our house so that temptation is not there if at all possible. So there are your foods that come to mind, like desserts or pizzas, chips, that are just no-brainer red foods. But there are quite a few sneaky red foods too. So we have families talking about, wow, this yogurt that I had every day, I had no idea it was actually a red food. It is loaded with sugar. Or this snack that I give my child, fruit snacks, for example. Many fruit snacks fit into this red foods category. Sports drinks. So it just helps to raise awareness about these red foods. And then our goal is to really limit those and then substitute for those yellow and green foods. So that second bullet, the yellow foods, are foods that are less than 7 grams of fat and less than 12 grams of sugar. These are foods that are good for us. They give us great energy, but we want to be aware of our portion sizes with these. So this could be like whole wheat pasta or skim milk, where once again, they're good for us, they give us good nutrition, but we just don't want to go overboard on these things. And then our green foods, our go foods, they're good for us no matter what. These are fruits and vegetables with no calories added. Have zero thought about how many portions or servings that you have of these. They're just good for us in general. So this has been something that a lot of families have used with goal setting of either increasing their green foods or decreasing their red foods as well. We use technology in a few ways for I'm Healthy Schools. We had a study-wide website that folks could go to get some more information. We had a public Facebook page that had just general tips, but we also had private Facebook pages for each of our families, each of our schools, and those families would be in their own private Facebook page. And so they could post things like, hey, here was a cool activity we did, or this is a cool community event that's coming up. Here was a neat recipe that I just found and my kids really loved it. So this was a cool way to interact. Some communities utilized this a lot, others didn't, but it was nice to have as a resource. One of the great things about us providing an iPad was that we were able to preload apps onto it to help with families' health journeys. So we had Strides, and that is a goal setting app. MyFitnessPal, many people are familiar with that, a great nutrition app. Plant-Nini was one that actually one of our families recommended, and this is a fun one for kids to use to track their water intake. And along with that, we really recommend decreasing those sugar-sweetened beverages while increasing that water too. So that's something that we kind of balance with that. Go Noodle Kids is an app and a website that many are familiar with. It's a really fun way to find neat and just ways to get moving for these kids. Eat and Move-O-Matic is an energy balance app. And then that virtual hope box just helps with things like coping and distracting and a really good mental health app as well. So as part of the program, each family and child did receive a Garmin device if they wanted one. And this was a fun way for kids and parents to challenge one another or to set goals around their step counts or activity. And then we also want to practice what we preach. So as part of these 1 hour sessions, we don't want kids just sitting in front of a screen looking at us or the content for an hour. So we implemented energizers, which are just fun, interactive ways to get up and move and show a variety of different ways to be active. So this could be like yoga or mindfulness or cardio, high intensity interval training. So our goal with that was just to hopefully introduce some different ways to be active that people weren't as familiar with. So moving on to I Am Healthy Parents First, our current study. You can see on the top left, Dr. Ann Davis, she's a psychologist in pediatrics, and she was the principal investigator, the leader of I'm Healthy Schools as well, has extensive work with kids and schools, and then her colleague, Dr. Beffert, in population health, also psychologist, has worked a lot with adults and weight loss and clinics. So they came together to develop I Am Healthy Parents First. And you can see a few of us of the team on the right side of the screen. There are a whole lot more of us as well. It definitely takes a lot of people to run this, but we have a really, really wonderful group. A little bit of background about I Am Healthy Parents First. This is also a randomized controlled trial. Families are recruited across Kansas and our neighboring states and are either randomized into the parent-only group and then proceed to the family-based group, or that there is a newsletter group followed by that family-based group. And as part of the study, looking a little bit closer at these two different groups, our I Am Healthy Parents First group in that left column, those adult-only group meetings are specifically for adult weight loss. These are weekly for 3 months. And then those randomized to the I Am Healthy group receive monthly newsletters for also specific to weight loss for that 3 months. But those in the I'm Healthy group are just given a little bit more flexibility. There aren't the structured group sessions like there are in the I Am Healthy Parents First group. And then following that first 3 months, both, no matter which group that they're assigned to, all families receive our family-based intervention, I Am Healthy. And this involves group meetings, one-on-one meetings, and self-led activity sessions, very similar to I'm Healthy Schools. And this is for 6 months' time. So we collect some information to see the effectiveness of the program. And part of this is weights at home using a study-provided smart scale and activity watches. And then they also complete some online surveys as well. A little bit more about the Parents First group. There is a manual, so no matter which group that someone's assigned to, all of the parents receive the same material, the same great material. Each parent who is randomized to that Parents First group also receives a subscription to MyNet Diary, which is a neat nutrition app. And you can also track and connect your activity watch, or you can track activity and connect your activity watches within it. And it also has a messaging ability. So our coaches can say, hey, how are things going? Or I saw that you went for a 30-minute walk last night. Great job. So that's just another cool avenue to help with communication and accountability. And then each household who participates in the study receives a smart scale, and each parent and child who participates receives a Garmin activity watch. You'll see that come up a few times because we really emphasize these, and it's been a really cool resource throughout this program. So for that family-based intervention, what we call I Am Healthy, it follows that 3-month adult intervention, and it's 6 months in length. As I mentioned, there are 3 different components. There are those group sessions, those family-based behavioral group sessions, individual health coaching sessions. These are one-on-one sessions with folks from our team to look at each individual's family's needs. And so those are more around whatever the family is asking for. And then we also have self-led activities sessions to help to implement the content that they're learning in groups even more. Everything is evidence-based all over Zoom. And really, really fun. There are lots of people. It is one parent and child who's required to participate, but we really encourage anyone else from the family who's interested in participating to join as well. We know that the more support, the better there. A few different tools for that family intervention. We recommend our apps still, even though there isn't a study provided iPad for I'm Healthy Parents First. We also have goal sheets like the one on the left that families can complete. These are just with dry erase markers. So we really encourage whatever the family finds is going to be most sustainable for them to keep track. We know that tracking behaviors really, really helps to change behaviors. So we just try to find or encourage a few different avenues for this. One very much being this goal sheet. We still keep with our Go Noodle, our fun activities. We, as part of the intervention, one of the apps that we suggest, especially for the nutrient density topic, is Chronometer. So you're able to input what you have to eat and drink, and then it breaks it down in terms of not only your macronutrients, but also your micronutrients as well. And then we really encourage using those Garmin devices to just continue with their activity, making sure that if they're already being very active, that they can continue being active, or if they want to, if that is an emphasis for them, that they can focus on that, and we can work to slowly build up their activity. Few study benefits, just access to a free online healthy lifestyle program. There is compensation involved with it, up to $275. And then once again, those Garmin fitness trackers and the Smart Scale, that's been an awesome resource throughout the program. There are a few ways that we use technology, as I've mentioned some of them already. We have, I guess we could kind of break this down. The first 3 bullet points are really for recruitment, and then those last 3 are for specific for the intervention. So we have a website that we have a lot of great information and materials on. We also have a public Facebook page that we post a few times every week and connect with our community partners through. And then we also have an email newsletter. So this is just an email broadcast to go out to our community partners about updates within the program, or just asking about what they need, providing resources, things like that. And then within the intervention, we have MyNet Diary for those randomized to the Parent First group. You heard a lot about those Garmin devices, but they have been a hit for sure with both parents and kids and have really made a difference with goal setting and progressing folks' journeys for their physical activity. And then we keep with those energizers, those fun interactive ways that Zoom really helps us to promote. We're able to share our screens, get something fun on the screen, and we can all get moving. Another piece of this is our, here, I'm just going to go ahead and share on this screen. Actually, it's the same thing as what's on there. We have a recruitment video that one of our team members, Hide, put together.
To help your family live a healthier
I'm going to
lifestyle?
pause on this. I apologize. Sometimes our on the PowerPoint, it doesn't cooperate as well. So I'm going to share it within our website. This is our I Am Healthy Parents website, IamHealthyParentsFirst.org. Just a place to land for anyone who has questions or wants to learn more. And then we have our recruitment video down here that Hide from our team created. So you can take a look at this.
Would you like support to help your family live a healthier lifestyle? I Am Healthy Parents First is a family-based healthy lifestyle research study that focuses on helping a parent and their child improve physical activity and nutrition. And the best part is that you can participate from the comfort of your own home. If you choose to participate, you will be given 2 Garmin fitness watches and a Smart Scale to keep. You will also receive up to $225 for completing surveys and providing weight measurements. Are you ready to learn more? Check out our website or contact our study team today.
So I will say that's been something that's been fun to
I am
share on social media, or an easy way for folks to digest the highlights of our study. And then I am going to put a plug in. We are recruiting for the next 2 months, still looking to fill up our final groups. So if you or know someone this is specific to Kansas, Missouri, Nebraska, Colorado, or Oklahoma, we're looking for kids in 1st through 5th grade. To be eligible, kids have to have a BMI percentile at or above the 85th, and parent BMI needs to be between 25 to 50. They must live in a rural area and want to make healthy changes. And currently, we are only offering our program in English. So, a few things that to go along with that. I mentioned our website. Families can go into the website and complete an interest form. So that's been another cool source of technology, just to be able to go into the website, quickly be able to navigate to the interest form, and then that notifies our team, and we are able to contact those families. And then within our website, we have a tab for our community partners that has just a package of all of our recruitment materials. It's very easy to download, just a one-stop shop that has our recruitment flyers, newsletter copy, press release, social media posts and graphics, as well as our study logo. And with that, I will pass it back over to Haley then.
Yeah, thank you so much, Maggie, for all that information on the study and kind of how you fit in with that. We do have some time for questions. I know we've gotten one in the chat for you, Maggie, so I will go ahead and read that one off to you. But everyone else, any questions you have, please get those in the chat for both Dr. Winkleman and for Maggie. So, Maggie, looking at the study, Lisa is wondering, how did you manage the privacy issues for the Facebook group for people to connect with each other? And was it just for participants, or were you involved in the Facebook group as well?
We had, that's a great question. For the privacy piece within the Facebook group, we were able to adjust settings for us to be invite only for those groups. And then each group leader was also involved with those groups. So we really tried to limit the number, and we were very upfront about the information that was allowable versus not allowable. And that's one thing that we very much emphasized from the very beginning, right from the informed consent of when folks sign the informed consent, is just really respecting the privacy of others in the group, because we know that that's extremely important and needs to be taken very seriously.
Yeah, thank you. Looks like we had another question, and then Dr. Winkleman will get to yours as well. It says, this one is currently a study. What are the plans to make it sustainable after the study has ended?
Yeah, I know. We're excited to see outcomes. We don't know for sure how things are ending up with this one, so we'll be waiting on results. But we have another iteration already going on of I Am Healthy, called I Am Healthy Clinical Practice Guideline, and so we're taking the same I Am Healthy intervention into clinics right now across 4 different states, and then we'll just continue to look for avenues. Applying for grants right now, just to expand this and continue on with the foundation that's already been built. So I know that's not super specific about things, but we're very, very excited with opportunities that are on the horizon.
Yeah, definitely. And Dr. Winkleman, I'm happy to read your question from the chat, but if you'd like to come off mute too, we can do it that way as well.
Sure. So I had 3 kind of separate questions. The first one, and you kind of touched on this, but what data sources specifically were informing the study? You mentioned a few different devices and apps. Are any of those included in the data sources? I know sometimes that is hard to obtain. And if not, what data sources are you using, like satisfaction surveys, scales, like what data are you collecting for the study? I'm assuming that it's to show efficacy of the program. I was just curious what measures you're using.
Yeah, normally I have a slide on this, but since it wasn't as technology geared, I ended up taking off, and I was like, I knew this question was going to come up. So thanks so much for asking it, Dr. Winkleman. We are tracking, our primary outcomes are around child and parent weight. and any changes there. And then those online surveys, we are tracking like the satisfaction. We are tracking, or we are measuring. We have a few different questionnaires around like quality of life. And like how parents think that genetics play a role within their own kids' body weights. Um, there are a few others just around questionnaires around physical activity and nutrition as well. So just, yes, exactly, seeing how those health measures change over that 9-month period.
Gotcha. And then I may have missed it, but was this a grant-funded initiative originally?
Yes, both of these were funded by the NIH.
Gotcha. Excellent. That's awesome. And then the last question that I had to do, you mentioned some individual coaching within the program, and I was wondering if the practitioners followed any type of theoretical framework when doing that coaching. My example in there was motivational interviewing. I'm sure that in the realm of nutrition and dietetics, there's probably other frameworks, but I just wanted to know what that approach was with that individual coaching.
Yeah, and that is one of the cool things, but also kind of one of the challenges. We do have our team consists of quite a few different backgrounds. So we have several registered dietitians. We have some who are training in psychology. We have in exercise science. So kind of bringing all of our backgrounds together to hopefully create the best materials that we can for our participants. And then our study is led by 2 psychologists, so they have a big role in this. So we do talk about motivational interviewing, and then how we've kind of designed it is to have a menu of topics that Dr. Davis has had quite a bit, or she's had a lot of say in what those topics are, and then each background has provided some different topics. And so we've created things that if parents bring up topics that we're able to provide education and science-based resources, evidence-based resources, excuse me, to address whatever needs those are. So yes, not necessarily a specific framework, but we definitely emphasize motivational interviewing, and then have a menu of different things that we can discuss.
Awesome. Very cool. Very cool. Thank you.
Looks like we do have another question for you, Maggie, in the chat. With the surveys, have you all been measuring any self-efficacy measures?
I'm trying to think of, we've had a few. Oh, that's a good question. I'm not sure if in our current survey packet, if there is something about self-efficacy, but I can look into that and get back to whoever asked that question.
Yeah, definitely just let us know, and we can always follow up with Lisa and kind of give her an update. Any other questions that anyone has for Dr. Winkleman or for Maggie?
I have a question for Dr. Winkleman. This is Lisa again. So currently I'm engaged with I do fatty liver disease and do a lot of nutritional kind of interventions, but really integrate a lot of behavioral interventions. But of course, we all know that there's alcohol as well. And I wonder, I'm thinking of getting kind of like cross training into alcohol use issues like misuse or addiction in combination with metabolic reasons for fatty liver and other health problems, as we all know, causes many different health problems. But I was just wondering if you had any resources in ways that I can get kind of cross-trained, or do you feel alcohol is just like a completely different animal, requires a lot more education, like a specific kind of education?
So I think that's great. And Lisa, from what I understand, you tell me a little bit more about your current role.
Yeah, I'm a nurse practitioner.
Nurse practitioner. Okay.
Yeah, so we do group programs, very similar to what Maggie does, but in a clinical setting as a shared medical appointment program.
Gotcha. So, so you already have training in substance use disorder, and alcohol is one of those.
I don't have training in substance use disorder. I do not.
Okay,
I'm a nurse practitioner. I work in liver disease.
gotcha.
And
Okay,
I do metabolic dysfunction associated fatty liver, which is very connected to what Maggie does, is weight management. However,
gotcha.
we have a lot of patients who drink alcohol and
Mm,
and they have misuse of alcohol
yeah,
or addiction, addiction issues as well.
yeah.
And this is in the whole, country. We have people with 2 reasons for fatty liver disease going on.
Yes. Okay. So, and your question was, is there resources for training for treating this particular um, uh, disease and this population with this
Yeah,
ailment?
for
And yeah,
alcohol
for
use
alcohol
disorder.
specifically. Most of the training that I'm aware of looks at the substance use disorder as a whole, and then alcohol use disorder is kind of a subspecialty. I do have a colleague who runs the addiction counseling program, and I can ask him if there are specific ones for alcohol use disorder. So we actually provide training to our physician assistant students on substance use, which includes alcohol use disorder. Um, when it comes to the training specifically, I think that there's probably definitely some resources out there that I can share with you. I don't have them off the top of my head, but I will connect with you. If you'll put if you'll message me your email, I'll look into that and provide any resources that I can on the topic. Because you're right, alcohol use disorder has its own set of complex interplay with overall mental health and physical health. It even affects our not just our metabolism, but our certain medications efficacy. And so yeah, there's definitely training that I think there's a gap in for a lot of healthcare providers. And that's something that we try to do at the Health Sciences Center is integrate not just mental health, but addiction services, specifically alcohol, because it is one of the most common.
For
And,
sure,
and
for
so,
sure.
yeah,
Number one cause of liver transplant.
yes. Yeah,
And
so I'll take a look at that and I'll see what resources I can put together to at least get you started on some training on this area. I don't know that a specific like certification or post-graduation training program, it might be helpful, but I think there's some additional resources that could be helpful for you and your team that I'll collaborate with my colleague to see if I can get you some of those resources sent to you. And I got your email, so I'll grab that and I'll follow up with you probably this week sometime.
thank you very much.
Yeah, thank you so much, Lisa, for your question, and Dr. Winkleman for getting in touch with some resources. I know I see Dr. Santos has put some other resources in the chat as well, with curriculum and counseling, and also looks like the National Institute on Alcohol Abuse and Alcoholism also has some free trainings as well, Lisa. But yeah, thank you for that information, and I'll follow up with you, Lisa, too. I'll talk with Maggie and we'll get some information on the self-efficacy question you had as well. All right, well, if there are no other questions, I do just want to say thank you again so much to Maggie and Dr. Winkleman and all of our friends at the TexLa Telehealth Resource Center for their help getting the webinar set up today. We do have an upcoming event tomorrow that I want to share a little bit of information on. So let me get that going. So yeah, tomorrow we do also have another webinar. It will also be at noon. So if you're registered for today's session, you should also have the calendar hold for tomorrow's. We will have Rochelle Marding going through the proposed physician fee schedule. So we look forward to seeing you all there. And then, of course, if you have any questions following the webinar, feel free to reach out to us at htrc@kumc.edu. We will also have TexLa's email in the chat here for you in just a second. And yeah, please let us know if you all would like a certificate of attendance, and we will get those processed and probably out early next week. But thank you all so much for joining, and have a good rest of your day.